So welcome everybody. Welcome to this wellbeing session, and we just invite everybody to introduce themselves. So please do use the chat to say hello, who you are, where you are today, your job role, and maybe what you do to look after yourself and your team. And if you send it to all participants, we'll be able to have a little, we'll all be able to see that. Olivia, do you want to share? Because I know you can unmute yourself.
Hi there, I'm Olivia Donnelly. So I'm a clinical psychologist based in Bristol at North Bristol NHS Trust. And yeah, I've just come back from a couple of weeks holiday up in North Wales in Snowdonia, which is utterly beautiful. So yes, quite a bit of hiking and probably more exercise than I'd normally choose to do if it was just me on holiday. But yeah, a bit of laziness in between as well.
So welcome everybody, because I see the numbers going up, and we're currently in Zoom at the moment and we're live on YouTube. So please do say hello and let us know who you are and what do you do to look after yourself and your team. I'm just going to check in with my colleague Elizabeth. Hi Elizabeth, are you able to unmute?
Hello Zoe, yes I'm unmuted, but I've still got some technical challenges here getting my camera to work. So I'm going to try one more time. I'll let you carry on in the meantime.
Or Elizabeth, why don't you just stay with us, and maybe we can work things out as we go through. But it's nice to have you, or if you want to try it off and on again, then just let me know either way.
I'll probably stay with you and maybe try and sort it out another time, but I'll just miss you. You will not be able to see me, but hopefully you can hear me.
Yes, I can definitely hear you loud and clear, Elizabeth. It's very clear.
Okay, let's work with that. Thank you, Zoe.
So yeah, welcome everybody. I can see there's 52 of us, and there's a number on YouTube as well. And I can, well, I just wanted to let you know there's lots of ways that you can stay in touch between these sessions. So there's a mailing list, and we'll put all these links into the chat box, both chat boxes. We're live on Twitter today as well. We're live on Twitter 24/7 actually, using the hashtag caring for NHS people. You can see it on the slide there as well. So please do tweet away during the session and after as well. And we've got this we've got a wellbeing community as well on the Tribe platform. So please do say hello in the chat box. Let us know where you are today, and maybe what you do to look after yourself and your team. I can see quite a lot of things coming into the chat box already. So it's 4 o'clock and welcome to our 15th wellbeing session. If you haven't joined us before, we have these sessions on the second Wednesday of every month. And currently we're focusing on the people plan and elements of the people plan, things that we could really all do help with in looking after ourselves and our team. So my name's Zoe Lord, part of the Horizons team, director of the Horizons team, which is part of NHS England and Improvement. And today we're going to be focusing on supporting my own and my team's wellbeing. If you haven't joined one of these sessions before, what we do is we hope to offer support, ideas, knowledge and wisdom to those in a role supporting the health and wellbeing of our staff. We want to share a range of wellbeing support activities that are available. And as always, we want to connect with each other. You can do this via the chat room, and you can also do this via Twitter as well.
Thank you, Zoe. On our agenda today, we've got me and Zoe who will be facilitating today's session. And then we'll get an update on the national support offer from Abdul. And we'll also have a session from M on supporting your own and your team's well-being. And Sonia will then join us and share with us a session on resilience and recovery. And we'll also have a session on enhancing our well-being through teaming from Olivia. And as usual, we will end by a call to action and some closing remarks from both me and Zoe. And on the team today, you've already met me and Zoe. Our contributors, we have Abdul, M, Sonia, and Olivia. And behind the scenes, just making sure everything goes well, we have Paul, Zara, and Tej. On our chat box facilitators today, we've got Karen and Louise. On YouTube, we've got Ian, and Ian and Lindsay, and on social media, we've got Lee, who will be tweeting right throughout the session. Welcome. So we'll begin by, I'll begin by introducing Abdul and inviting him to share with us the update on the National Wellbeing Offer. Welcome, Abdul.
Thank you very much. And I'm really pleased to be joining you all and providing an update. Normally, it's something that Sonia has been doing, so I'm following a tough act, and hopefully I will be able to give you an update on where we are. Can I have the next slide, please? So this slide just gives you a sense of some of the stats that we are capturing, which highlight how well our offers are being received and the take-up of the various different channels that we are using. And from there, you can see that we've had just over 5,000 people access the Samaritans helpline that we've set up. Equally, at the same time, we've had just under 6,200 contact the Samaritans helpline, but not use our direct channel. So that's NHS staff who still continue to access support, but perhaps don't feel comfortable in accessing NHS-related support. That's a piece of work that we need to continue to look at and build on. We also have a shout text service, and we've currently had also over 2,000 conversations related to that, so where people are accessing help and support. And then obviously in terms of app downloads and access to our people website, combined, we've got something like 400,000 there, or just over 400,000 people. So all in all, we're getting very close and very proud to be reaching that 500,000 mark of people accessing our support on a range of offers. The slide gives you a sense of some of the sites that have been most visited in the last 2 months to date, so August and September. So you can start looking at there in terms of people shielding, coaching and mentoring, and also kind of rewriting as a team. And some of the numbers that I've got for coaching is we've had over 1,000 participants in our coaching and mentoring offer. We've been doing the React March on Stress training. We've had approximately 500 people complete that training. So those offers have proved to be really, really successful. Some of the frequent issues that we are picking up are highlighted in the slide as well. So it talks about some of the anxiety and distress, tiredness, and people feeling worried. So we are seeing more and more of the secondary stresses coming through, which I'm sure Sonia's going to touch upon and as part of her contribution. And then in terms of some of the things that we've got coming up in the next few weeks and months is that we are collating a range of data around mental health. We also have launched today the Executive Leaders Offer. There's plenty of that on the Twitter community. The idea really there is to support leaders during the challenging times, but also to help and aid the delivery of the People Plan 2021. And the kind of things that are covered in the Leaders Offer is Executive Leaders Seminar Series, Kingsford Masterclasses. We've got virtual actual learning sets, a Chief Executive Development Network, reciprocal mentoring for inclusion, leading in systems, and there are also some offers from a regional perspective. So a really exciting offer that we've launched today, and perfect timing in terms of the webinar that we've got today. We'll also continue with our work on the common rooms. In the past months, we've done some culturally sensitive or culturally diverse common rooms, and we've also done some healthcare scientist and clinical research practitioner common rooms, and we're just about to launch a couple of common rooms linked to home workers, so we're really looking forward to that. We've also got a team time support offer via point of care that will target 30 or so organisations with high staff patient COVID deaths and high BME staff percentages that are not currently part of the Schwarzschild network. So that's going to be kicking off from next week. We're also working with our colleagues in the Mental Health Directorate in hopefully starting the wave 1 of resilience hubs. This will be a joint initiative between the People Directorate and the Mental Health Directorate, initially with one per region. So we're going to have 7 as part of wave 1, and that will look at providing outreach to staff, but also providing support for people that are able to access some of the mental health support offer. And then we've also got the launch of a national financial health and wellbeing offer planned in the next week or so. And building on the success of the March on Stress, we're looking at a train the trainer offer to build capacity and capability within the system. And lastly, we've got the bereavement practice coming out shortly, along with some animation to support bereavement practices linked to various different cultures. So there's a lot of exciting initiatives still to come through. And obviously there's quite a few that we've already got on our People website. Could I have the next slide, please? So this next slide kind of gives you a sample of the kind of things that people can access and how they can access them. So we've got a range of offers from apps, guides, direct one-to-one support, and team offers. So I won't say much on there, but what I would say is that we are really here to support you and your fellow NHS colleagues, and hope that the offer that we've done is responsive to the needs of the community or the workforce. But if you feel there's anything that we are missing, or there's evidence that you're picking up that we need to respond to, please feel free to share those ideas and thoughts with us, and please use the chat and the facility to kind of highlight both what you think we need to do more of, or some new things that we need to respond to. But equally, if you come across any good practice around psychological health and wellbeing, please do make us aware of that, because we're quite keen to link in and, where possible, promote those offers. I think that's about it for me. I'll hand back over to Zoe.
Thank you very much, Abdul. A really good roundup there of what has been on offer so far. And as one of the NHS colleagues on the ground, I know that a lot of people have benefited from that support that you and your team have put together over the last few months. So thank you, and thanks to you and your team all around. So I'm going to introduce our next contributor today and speaker. Professor M has been with us before. Professor M is the NHS Deputy Chief People Officer, NHS England and Improvement, and she's going to share with us about supporting our own health and well-being, as well as supporting our teams. Over to you, M.
Thanks, Elizabeth. Hi, everybody. My name is Em Wilkinson-Bright. I am a 50-year-old woman who still loves working in the NHS after 31 years. I have a son who's 14. We are currently living in a hotel because we've had a flood in our house. And the reason I'm specifically doing this is because I'm also the Deputy Chief People Officer for NHS England and NHS Improvement. And what I wanted to just talk about briefly was how we bring our whole selves to work. Because what really strikes me over the years that I've worked within teams and in organisations is how often we introduce ourselves by our name and then the title of the job we do. And actually that doesn't say very much about who we are as people. And I, for a long time, feel really passionately that first and foremost, we are people first, and we have our lives, and we have all the wonderful uniqueness and complexity that makes us who we are. And yet so often when we start out with an introduction, we don't do any of that. We just jump straight to, here's the job I do. So I wanted to just frame this a little bit, because whilst the subject is resilience, and I am the Deputy Chief People Officer, I'm also been a nurse for 30 odd years. I was a chief nurse for 15 years before I took this job on. And I have watched many teams and individuals contribute the most beautiful care to patients, and not just clinical staff, every member of a team. I have seen receptionists, I've seen porters and cleaners and admin staff. And I think that there are many times when I also see the emotional burden that creates in people, because when the magic happens, it's often because people give of themselves. So for us as leaders at all levels throughout the NHS, I just feel that we must really think about how do we support the ability for people to keep on giving, recognizing that people have their own very unique circumstances. So, you know, caring responsibilities, concerns about, we've just heard from Abdul about the secondary stresses that are coming through repeatedly in the feedback. And I think it's really important that we don't forget that if we are going to live and breathe the people promise, which Zoe's going to flash up on the screen in a moment, this is something that the people of the NHS asked for, and asked for as a promise to each other, as a promise to ourselves, and as a promise to anybody who's coming into the NHS. And this is what people have said they want to see in the NHS. They want to be able to say this is true in the next few years to come. So if we are to make that a reality, I think we have to very definitely think about how we bring our whole selves to each of those domains, and when things are out of balance on any one of our aspects of our lives, how sometimes it will be really difficult to make this happen. So we talk about resilience. I know that resilience creates antibodies in some people, because people have said to me, why do we keep talking about making staff be more resilient? Should we not be addressing the root cause factors that mean that we shouldn't have to ask people to be more resilient? But as human beings, there is a resilience in the way we deal with life. I guess what we also know from much of the evidence, and I don't deem to be any expert on this, I should leave Olivia to do that, and Sonia, but we do know that people derive resilience from being in a team. And actually there's a huge amount of support that comes from that. And I can think of many occasions when I've had that myself. But I think I just want us to really think about, through this session, some of the questions that we might want to ask ourselves in those leadership roles about this people promise becoming a reality. What things do we need to pay attention to in the space of resilience and bringing our whole self to work? Really interesting, in the chat box, people are talking about already the things they do, and there's an awful lot of in there about checking in, making sure that people know how people are at the beginning of a meeting or a day, and also checking out. So many times I've heard people talk about how hard it is to leave work well, because it hasn't been left behind. You know, that emotional demand goes home with you. So I think for the health and wellbeing programme, for the people plan, I'm really delighted that we've got such a strong focus on health and wellbeing. I'm really delighted that people have told us how important it is that we recognise that the work we do in the NHS is hard work, it's rewarding work, it's emotional work, and therefore we must look after ourselves and each other. And the people promise is one way of doing that. So I am really excited to hear the next 45 minutes. Be very helpful to get any reflections back in the chat box, and let's keep making that magic happen.
Thank you very much, Em, for sharing that. We're all very excited. I certainly am, about our NHS People Plan and seeing how that plays out in action in our work areas. So I'm going to go over to Karen now to just share with us what's coming out of the chat box. Any themes, any comments there, Karen?
Yeah, I think people were quite quiet. I think they were really listening. But I know that Caroline and also Becky really loved the quote about when the magic happens, people ringing. But I was really struck, like him actually, at the beginning when people were talking about all the things that they were bringing themselves and checking with the team and the different things that were happening. So there was a really range as people were checking in about, I love the things from Che, which was like having a laugh, checking in. Amanda was saying a tea, chat and stretch opportunity. And then also the formal things that people were doing around regular team check-ins, and also using the health and wellbeing resources for their team. So that was that real mix of people bringing their whole selves and really checking in with the team in both ways.
Thank you, Karen. I've just spotted a comment in the chat box from Cheryl Samuels, who says, let us just go and make the magic happen. Thank you, Cheryl. So there's a lot going on there, and thank you all very much. So I'm now going to introduce our next speaker, and that is Yeah, thank you, Zoe. I've got the slide up now. We've got Dr. Sonia Wellbeing, who is our Health and Wellbeing Clinical Lead in the People Directorate, NHS England, NHS Improvement, who will share with us about resilience and recovery. Welcome, Sonia.
Thank you, Elizabeth. Hello, everybody. Nice to see so many friendly faces again. We can have the first slide. Thanks, Zoe. I'm really pleased to hear giving you that sort of warning about resilience. I've worked with teams across the NHS, in Australia, in the United States, around what makes us resilient, actually. What is the real definition of our bounce back ability, as I would describe it? And this was before it became a dirty word about actually how hard am I? I think often we can get resilience mixed up with a lack of emotion, not being able to be affected by events, rather than the real resilience lies in your ability to understand what impacts you, how you cope with it, what your triggers are, and actually when it's time to stop and take some care of yourself. My little health warning about resilience is always, it's never just about you. And actually we'll go to Olivia in a little bit to talk about teams, but your team, your culture, the relationships you have with your line manager are the single most protective factors for positive staff experience and your own resilience. And those of us who have really good relationships in our team will recognise how that makes us great. So, you know, impacting on your personal resilience and your ability to thrive in your environment, resilience does not just sit and reside within ourselves, but between us in those relationships. I have to say a big shout out to the artists who work on the people.nhs site for my beautiful drawings. I use them regularly because I think they're so nice. Carry on, please, Zoe, thank you. So I just wanted to really help you to understand that experiencing psychological stress at the moment is perfectly normal. You know, Em talked very heartily about some of the challenges she's having to deal with and do this amazing, massive job. We're all going through our own kind of personal lives. My kids have all left me this week, off to university, back to school, actually feeling signs of psychological stress during a pandemic when we've been locked in and we're dealing with things differently is not unusual, and distress will not always turn into disorder, which is why we say very often the levels of support that you get, how you're looking after yourself, is really important. Now, often what we notice is that we don't see how people are feeling, we see how they're behaving. So my message here is, when you're seeing some of these behaviours, and I know for our guys in our team, you know, when we're up against it, it's that sort of snappy, agitated, maybe a little bit of indecision, that constant worrying and finding it hard to follow stuff through. Just ask yourself maybe what lies beneath, because often we're not able to tell people what it is that's actually on our mind, maybe not even recognise that in ourselves, but actually it's the change in behaviour that might indicate that we're under a little bit more stress than usual. Thanks, Zoe. If we could have the next one. So the way that the brain processes stress is really powerful and very quick. And it will go through two stages. So the first thing it asks is, oh my goodness, is this thing I'm facing stressful? Reaching a conclusion of yes, we then get another bite of the cherry. So we ask ourselves, yes, but can I cope? So the more that we work on our capacity and ability to cope with the way that we deal with things in life, the better chance we have at being able to cope with life stressors. And let's face it, life will continue to throw us these very different curveballs. So getting ourselves in a better position can only be good for us. The reactions that we experience through stress and the mark that leaves for us, you'll often recognise as very primitive behaviours. So I don't know about you, but I get to the point, if I am very, very busy and overwhelmed, even just the decision making about do I want tea or coffee can be difficult. And I've given you there, if you haven't read Kahneman's book around what is it called, Think Fast and Slow, I think that's the two phrases he uses, really good reference point about System 1 thinking is just reactive. It's just in the moment. I've got to make a decision. Here I go. Not very intelligent. Just reacting. And then system 2, which is the better space to be in, is I've now engaged with the layers of cortex in my brain. I'm thinking through. I'm reflecting on my experience, and I'm slowing stuff down. Now, Helen, I know I've heard you talk about every time Michael West comes on and does a little talk, he takes me into a system 2 space. There's something about his tone and his voice and the things that he says that takes you into that really slowed down space. And your breathing can do that. You can, just by that deep abdominal breathing, when you find yourself up against it, takes you from system 1 instantly into system 2, because your brain thinks, well, my goodness, I can't be under that much stress if actually she's finding time to breathe in and out really deeply. So again, just a really cool trick to take you into that better space. Thanks, Zoe. If we can go into the next slide. So things to watch out for. The impact of stress. You first of all will release cortisol, and then obviously that's going to have an impact in your brain, means that your cells are communicating less well together. You'll recognize this. You sort of start off with adrenaline and cortisol then comes later. The problem is cortisol hangs around your brain for a longer time. Ladies, I'm sorry, it eventually will make its way to your hips. So it's not something that is good for you to be producing on an ongoing basis. You need to work through it and find better ways to not put you in that difficult coping state. Now, short-term memory, you'll know this from all of the research we've got at the moment around dementia and the rise of dementia. We know that one of the casualties is age-related memory loss, and that follows a lifetime of negative stress. So if you look at some of the people I'm closest to who've had really kind of high-level jobs, and then what is it that they've been doing later in life, really struggling with some of this memory stuff. So I definitely think, those two things are not unrelated. You'll see a lot of behaviour. So in 4,000 staff that we studied who were having symptoms of stress and were involved in restorative work with us, you often saw lateness, absence, relationship difficulties, challenges of motivation. That's what we see. But actually what's going on beneath is a bit of stress, burnout, compassion fatigue, which is the lack of pleasure that you get from your job. So really, really important things when you're thinking about Em's description of beautiful care episodes. If you're in a bad space yourself, you're really unlikely to be able to provide that presence of mind and thoughtfulness for other people. Thanks, Zoe. We can have the next one now. So again, for those of you, I know that there's some of you academics and health and wellbeing leads on the call, have a look at this study because it's really, really worrying. So what the Whitehall study has looked at middle management over decades. What happens to those managers stuck in the middle of that spam sandwich? Now I say spam, not jam, because it's not a nice space to be. And anybody who likes spam, does like spam, forgive me. But so what it's come out with is the jobs that have high demands. It's not the demands themselves, that's good, that are a major cause of illness. It's low control. Now, if you work in an organisation where you've got lots and lots of expectation on you, but you're not able to make decisions, you're not able to get stuff through, then that's the cause of significant serious illness. So have a look at that site because it tells you all about the challenges that middle managers face in terms of their own health. And we're talking about cancer, stroke, coronary artery disease, all of the nasty ones from a lifetime of feeling just compressed. So what have we got to do? We've got to involve ourselves in that collective leadership, release people to be able to make decisions, because actually it's really great for their long-term health. When we're under pressure, what do we tend to do? Probably the opposite of what we need to do to look after ourselves. So we work longer, we work harder. I'm sure we can all recognise that. And of course, that then increases the impact of negative physical health. Our team, our colleague relationships are under pressure, and we have reduced capacity to support ourselves. I know Cheryl is with us on the phone, Cheryl Samuels today. her and I constantly have these check-in calls at about 5 o'clock just to give us that sort of support system. I would really encourage you to think about who your peer buddies are. How do you decompress at the end of a difficult shift? I don't know about you, but my life is not something I want to take to the dinner table with me. I tried it a couple of times. They roll their eyes, nod off. They're not interested in the same way our colleagues may be of us. So having that space and time to decompress is really important. We know that stressful relationships are linked to mental decline, and the usual protective factors, if you think about your family, your friends, they're not available to us when we're doing some of these really difficult work, and when we're exposed to, you know, some of the stresses that we found in COVID, death and dying. You know, your family and friends don't want to support you through that. So you're going to need to be thinking about where some of those support systems lie. Thanks, Zoe. So I just wanted to give you the opportunity to have some really practical tools to take away. This is one that's really helpful. So depending on where you are in the arc, what we know is that the red zone is linked to all those kind of difficult outcomes in terms of negative impact on physical behaviour. So the longer time you spend in the red zone, the worse your long-term health is going to be. Now, don't get me wrong, it's not to say that you don't go to the red zone, but you might holiday there. You don't want to live there. It's not good for you. So what I try and do is just have one of these arcs up and just think about various points in the day. How much of the red zone am I in? The green zone, again, probably not good for you. You can just experience as much stress from being bored and underutilized as you can from being overly stressed. So you're kind of going for that peak performance, which is your middle zone there. Thanks, Zoe. So we were going to do a poll. Zoe, shall I hand over to you to do the poll, if that's okay?
Yeah. So we're going to have a poll at this point, but I just thought I'd pause for my reflections. It's a little bit like, ooh, it feels a little bit close to home. So if you're feeling, oh yeah, I see these too, then please do add them to the chat box. So we're going to do a poll now. So we're going to do this in YouTube, in Zoom, and if you're in YouTube, then put your answers into the chat box. So I'm going to ask my colleagues Paul and Tej to set the poll up for us. And we were just wondering, where are you personally on this at the moment? So is it number 1, blue, number 2, green, yellow is that optimum peak performance? Is it number 4 in the orange, or number 5? So let us know where you are at the moment. So if you're in YouTube, then please do add it to your chat box, and I'm going to come to Ian in a moment to look at your results as well. So we'll spend a few more moments. I can see they're coming in quickly. Lots of people have voted, and the majority is sort of in the orangish region at the moment. Give you a few more moments because I can still see them coming in. And we will close the poll now, and if we could view the results. So there we are at the moment. So the majority of people are saying they're in the orange zone. There's a few in the yellow and green, and not too many people, just 1% in the blue and 1% in the red. Ian, what's it looking like in YouTube at the moment?
So Catherine's come through on YouTube and has responded nicely to us. Catherine's saying that she's also been in the orange, so she's been in the number 4 side of things. And I was reflecting myself actually on some past experience of you know, in my career, of actually being in the blue and being a bit stressed, being a bit bored and a bit unaware of why I was feeling stressed. So yeah, that arc, I think, made me think, and I hope it made Catherine think over here in YouTube as well.
Thanks, Ian. I'm definitely going to pick up from this and maybe print it out and do what Sonia said and just have a little think about where I am at different parts of the day through this. Back to you, Sonia.
Thanks, Zoe. We can go on to the next slide as well. Thank you. So for those of you in orange, I would just encourage you, whether it's a 5-minute mindfulness in the midst of your day, or you're more of a physical relaxer and like to walk, think about doing something positive around your own mental health and well-being. Now, I always use this slide and stress there is no judgment from me here. You may well be doing a lot of things that are in that red category, but do you know what? I think all of us at some point are doing things that are either harmful or useless in terms of coping. Now, this again is from the research data. So what this slide is telling us is, what are the most helpful ways of coping that lead to positive longer term health outcomes? And what are the ways of coping that actually might hurt us in the longer term? And things about, you know, eating more, drinking more, that, you know, some of this is fun to do. So why not? Again, you visit it for a while, but don't use that as your mainstay. The things that are much more helpful to you are around thinking about connecting with other people, thinking about connecting with your own purpose, being physical, active, moving, are all about what humans are meant to do. And therefore going to those as your mainstay are really helpful. And then the ones that are useless tend to be around, you know, just ignoring it and pretending it may go away. Again, may work for you for a little while, but it's going to come back and bite you in the long term. So get up and do something about it is probably the message. Thanks, Zoe. Last slide from me then. So what do we know that reduces stress? Really important stuff here around good managerial support. The line management relationship that you have is absolutely the most significant protective factor. Are you on? Can you come off mute? I just want you to tell the group here what you said to me earlier about your idea with Michael West.
Oh, so I was at a meeting yesterday with Michael, and we were talking about how we actually really make some of these changes happen. And what we were reflecting was that boards are important, but actually this is about leadership at all levels throughout a system, throughout an organisation. And so we talked about, came up with a strapline about loving line management, and saying that actually if you're in line management, we need people to love it, but also we need to love our line managers, because actually that is where the greatest influence can be brought to bear on a member of staff's experience of being at work, and probably being able to be truly themselves and bring all of that creativity and talent. So yeah.
Thank you, and couldn't agree with you more. Evidence couldn't agree with you more. The relationship with your supervisor is significantly more important than the relationship with your co-worker. And whilst it's nice to have great supportive co-worker, you can't replace that relationship with your bosses. Collegiate support, boundary of ways of working together. So that sense of, I know where you begin and end, we're not continually tripping up against each other. And again, knowing that you've done a good job, even in adverse circumstances. So we know one of the most challenging things at the moment is people really not feeling that they've been able to care enough. But actually what we've got to remind people is we've done as much as we could do given the circumstances. And then, of course, identifying what is beyond your control. There's lots of worrying we could be doing right now. Will we survive winter? Will we get a second spike? None of those things are within our control. So we have to focus on our plans, our preparation, so that we can let some of that stuff go. Thanks ever so much, Zoe.
We have one more slide.
Oh, I forgot about the most important one. So this is the resilience wheel that I rely on, just in terms of the balance in your life needs to make sure that you're paying attention to all of these different elements. So starting from the reason that you're coming to work in the first place, how congruent you are with your vision, all of the way through to how you solve problems, the way that you approach life in terms of your own persistence, your own optimism, and then actually how you look after yourself, how you interrelate with other people, and how you regulate yourself. So much more on that out there on the webpage and stuff related to this work, and happy to share. But that's just a starter for 10 to, again, give you a practical tip on the wheel of balance you want to be having a look at.
Thank you very much, Sonia. A lot to take on from that. I really love that idea of love your line managers. And also just that constant reminder that as line managers, we really need to support and work closely with our colleagues. And it's a really, really important relationship. Thank you very much for that. I'm going to go over to Louise to just share with us what's coming out of the chat box, and if there are any questions or comments for Sonia. Louise.
Thanks, Elizabeth. Yeah, there's a lot of chat going on now. Not so many questions, but I would just like to share a very heartfelt thank you to everybody who's sharing their experiences in in the chat box, whether that's indecision whilst doing the food shop in the supermarket, as a, you know, and that's being sort of a symptom of the pressure that people are experiencing. A lot of what you've described, Sonia, has helped people reflect on their own experience and their own needs right now. So thank you very much for doing that. Lots of thanks coming through. And lots of sharing of good practice as well. So we've had from Becky Martin, for example, trying to encourage people in her team or organisation, focusing on tiny acts of micro renewal hour by hour throughout the day. So whether that's staying hydrated, getting some fresh air, texting, you know, all those sorts of things, those great ideas coming through. And certainly a question from Nicole in the chat box at the moment is kind of a rhetorical question, I guess, really, wondering about how loved line managers currently feel. So that's great learning, I think, and lots of conversation going on now, and our usual pattern of lots of quiet kind of bits where everyone's listening and hanging on your every word, and then it kind of goes off again. So thank you.
Thank you, Louise. Anything you'd like to say on that, Sonia? On what Louise has shared? Probably lots of it was just comments, but I know that, like many people in the chat box, it's just really, you know, the gratitude we have to get all these bits of support, really useful tools that you can put into practice immediately to just support how we are feeling at this point in time and to help us go forward. So thank you very much, Sonia. I'll hand over to Zoe.
Thank you, Elizabeth, and thank you, Sonia and Em as well. So we're now going to move on to thinking about enhancing our well-being through teaming. And Dr. Olivia Donnelly is going to be speaking in a moment. But what I did want us to do, just before we do, is just go back to this stress arc and think about our teams. So before we were talking about where do we think we are, where do we think our team is? So I'm going to ask for the poll to come back up. And let us know in YouTube as well. If you can't see the poll, which is currently on your screen, then please do add the number or the colour to the chat box. So I can see already that the orange is quite high. So please do add to the poll if you can, but if not, please do add to your chat boxes as well. So just a few more moments and we'll close the poll in a moment. But what I can tell you from what I can see from my end is very similar pattern. Orange is very high with 62%. It's 5% on red, and green and yellow are also quite high as well. So if we can publish those results so everybody can see those, that would be fantastic. So they're now live on your screen at the moment with 62% in the orange zone. So we'll compile those results and have a look at them both together, both the individual and the team. So over to Olivia. So Olivia is a consultant clinical psychologist at North Bristol NHS Trust. And over to you, Olivia. So you're just on mute at the moment, Olivia, but you've shared your slides and I can see them. So if one of our tech, here we are, I can unmute you. There we are, lovely. And if you just put your slides onto presenter view.
So hi everyone, thank you. That's a bit of my whole self, the tech showing up in this process. It's a real pleasure to be here with Em and Sonia and you all together today, and really delighted to be joining you to think about how we can enhance our well-being through teaming, a curious word that I'll say a little bit more about in a moment. But beforehand, building on the poll that we've all just done around where we're at in our teams, I'm going to invite you all to take a moment to pause and think about your own work, think about your own well-being, and just notice what shows up for you in relation to these questions. So what makes a good day for you? What matters to you in your work What's the most meaningful part of your work? And what makes you proud? And when you're at your best, what does that look like? And when your team are at their best, what does that look like? And so often when I share these themes or explore these themes with colleagues, people often share with me that a good day, a day when they felt proud, is often about making a difference in some way, often around the care that we might be providing to our patients. But people often say that what also makes a good day are our connections with others, whether that's about learning from colleagues, feeling supported, doing things that are really challenging together. That these are some of the things that make a good day. It's really about making a difference together. And so I think what's interesting is we often see resilience, as Sonia mentioned earlier, as being framed as an individual concept, something that's just kind of within us. And yet any individual, I think of any individual who might be working on a ward that is understaffed, with insufficient resources, without enough support, is very likely and understandably going to feel stressed and overwhelmed at times. This is absolutely normal. It's not a mental health issue, it's an organisational one. And so instead, as well as environmental factors, resilience and well-being are much more helpfully seen as being processes that come from connections that are between us. And so bearing this in mind, and the fact that working in the NHS, we're inevitably working in multidisciplinary teams often, team working is core to what we do. We need to focus on interpersonal team well-being, not just on individual qualities. But what we know is being in a team isn't enough. The quality of these connections is really key, both to our well-being and also to our performance. And this term teaming is one that Professor Amy Edmondson has coined, which is really the kind of verb of what's the behaviour that we express within our team. But what influences this quality of teaming? And you might have heard of this really exciting research project that Google did called Google Aristotle. And what they did is they looked at 180 teams, really exploring what are the factors that lead to those teams that are most high performing. And the number one factor that they found when they looked down the microscope was this: psychological safety. And as it says here, this is a shared belief that's held by members of a team that the team is safe for interpersonal risk-taking. And so this is fostered in many ways as this word cloud that we've got here, which was pulled together by some participants of one of our Act for Wellbeing courses. For example, showing humility in the face of challenges, being curious about what team members bring, being willing to take risks, being willing to make mistakes, being able to get it wrong sometimes. And I think what's really interesting about this is about a climate that arises between people. It's not a personal quality within us. And so, in other words, what really matters is less about who is on the team, but also perhaps more about how the team work together. And so, I guess on learning this exciting research, I did what I often do, which is I bought some books, and looking at lots of people's Zoom backgrounds recently, it looks like people have been doing that as well. And what's really apparent is the research is compelling, but I think I noticed in myself a real gap between understanding and feeling, clear that aspects like psychological safety and teaming are important, but this gap between that and then how do you actually do this in the real complex, dynamic, busy, changeable healthcare environment that many of us are working in. And this is a question that me and my colleagues at North Bristol Trust have really been thinking about a lot lately. And we were really lucky to have Professor Amy Edmondson join one of the previous Horizons events. And I loved her call to action that she shared with us, which was to experiment vigorously and broadly to discover what works. And so this is what we've been doing in Bristol. We've been testing out a number of different approaches to look at psychological safety and fostering teaming. And I'm going to share 3 of the pilot programs that we've developed that we're working on at the moment. So the first one is called Start Well, End Well. And the need for this came in the early stages of COVID, when teams were having to form very quickly. Colleagues were having to coordinate and collaborate, often with new people that they'd never worked with before. sometimes with people that they couldn't even see because of all of the PPE that people were wearing. And yet they still needed to work together to provide really high quality patient care in some truly exceptionally demanding circumstances. And we knew that there were barriers in terms of time. We know that there was already huge amounts of change. And so we worked closely with some of our fantastic senior medics and quality improvement team at North Bristol. And together we recognised that there'd be real value in working with existing ward processes that are already in place, with colleagues that are on the ground taking a key role in leading this. And so I think of this a bit like we might try and sneak healthy vegetables into our children's pasta sauces. It's how can we weave really good psychological care into our routine care, into our daily procedures. And this approach is really also about bringing psychological safety and well-being, kind of bringing it upstream a bit, rather than us waiting for things to go wrong. So briefly, more than happy to provide more information about this, but there are 3 stages in this approach. The first is a check-in, which is effectively an enhanced safety briefing, which looks like something you'd see on many wards, but with something a little bit extra. This section here, which is inviting actively every day at the beginning of a shift to remind colleagues that this is a team where it's safe to speak up. And whether that's about they have concerns about something happening with a patient, or whether they feel, for example, that the team need time to briefly come together and have a pause, or what we call our peer-to-peer debrief or pit stop. And what's important is this step 2 isn't a psychological debrief, which we know is contraindicated, but it's really a kind of a huddle. It's a guidance, a simple guidance around coming together, around checking in with each other, seeing if people are doing okay, if people need any extra support. We can signpost to approaches like TRIM or our trauma-focused pathway if need be. But in many cases that might be about pausing, checking in, and then like a pit stop, you then zoom off again if it's all safe to do so. And step 3 is something that Sonia mentioned earlier, is the checkout. And importantly here, this is something that is done with other people rather than just stuck on the back of the loo and something to reflect on yourself. Ideally, it's with others. And we've included in there, one of the steps is about appreciating. Can we actively thank each other at the end of the day? We know that appreciation can make a huge difference and help us to feel like the work we're doing in challenging circumstances is really important and matters. And so we've been learning a lot, we still are, through Start Well, End Well, but including a couple of things I wanted to share were the real value of having inside champions from people who are working within the team. They own the approach, they take it forward, and they've got the freedom to shape it to their context. The benefit of having some on the ground coaching from members of our Start Well, End Well team. And although we focus this so far on clinical wards, of course, we know that teams exist in lots of different ways. And so we're going to be working with NHS Improvement to look at how we adapt this for our non-clinical colleagues as well. The second pilot that I want to briefly share is called Me and My Team. And the context for this was the understandable anxiety that I think most of us felt in the early stages of COVID. And recognising that we needed to try and foster psychological well-being. In our trust, we've got over 9,500 people, so big task. How do you do that? And recognising the key role that's been mentioned before about how managers, the role that they can play here. And again, here's Amy Edmondson, who says the most important influence on psychological safety is the nearest boss. So with that in mind, we offered a coaching style conversation to help build our managers' confidence and their skills to have psychologically informed conversations with their team, but importantly, an opportunity to also think about their own well-being. And this included in the framework that we've developed aspects like, well, understanding normal human reactions to abnormal situations, practical ways to foster psychological safety, and a sort of how-to guidance for the peer-to-peer pit stops that I mentioned before. But I think it's important to say that although we have got a pack here, it's not something we would just email out to people. This is very much a conversation that's adapted to the manager, to their teams, to what they need. But interestingly, there was a theme that I noticed coming up with a number of the sessions I have run, which was around giving our senior colleagues permission to not know sometimes, including around things like PPE. And sometimes seeing that being open with our colleagues with the inevitable uncertainty that we will all face at times could actually help to strengthen trust rather than the other way around. And some of the colleagues I work with actually shared that this was a bit of a light bulb for them. The third pilot that we're working on, this is something actually we've been doing for a few years now, is called Act for Wellbeing. And it's a program that runs over 3 sessions based on an approach called acceptance and commitment training, which is a really fabulous, compassionate approach to supporting wellbeing. And for those who are less familiar with ACT, the name comes from accepting factors that are outside of our control. That might be things like COVID, or also kind of internal experiences like feelings that might show up when we're doing things that are challenging or important. And the commitment is around making contact with our personal and our team values and doing what matters. And we've run over 25 of these now at North Bristol, and increasingly have been tailoring the content to try and foster and turn up teaming. And so although we know that the outcomes for this approach are really strong in terms of individuals, this is just one bit of data of the general health questionnaire. And you can see there the clinically significant scores for distress go down significantly on the red portion on the left, which is at the beginning of the course, compared with at the end, which is on the right, as well as changes like self-awareness, self-compassion, and people saying that there's a shift from knowing what I should do when it comes to self-care to actually doing a bit more doing. But I think what's perhaps even more interesting is around the outcomes reflecting enhanced teaming. For example, the appreciation of common humanity. So one colleague shared, it's really helpful remembering that we're all humans with complex emotions. People shared both feeling more supported, but more proactively appreciating other people, including sometimes appreciating upwards, like you said, your line manager. An increased sense of connection. So in this course, people come together with people they might not previously know, and people have described the sense of being in it together, being part of something much bigger, and the power that small changes can have on others. For example, walking into the hospital and looking up from your mobile phone or putting in your handbag and smiling and saying hello to colleagues, or for example, feeling anxious and speaking up at a team meeting about a patient's care, even if you're the most junior person in that team. And so, although these approaches in some ways might look quite different, there are some golden threads that we've been trying to weave in what we're offering in Bristol. And some of these are about opening up conversations that are about supporting connections between peers, as well as that shift from not just what's the matter, that is a really important question, but also what really matters to us, because there's a sense that we can feel much stronger when we connect in that way. This is about empowering people to develop approaches in their own context. We know that engaging people is so much more helpful than telling, but that our colleagues are the experts in their context. And of course, they're the people who are going to take this change forward. So having champions on the ground is key. Putting knowledge into practice in a values-led way. So information isn't enough. Talking isn't enough. It's really important that we have skills. We need skills and to practice putting these into the real complex world that we work in. And encouraging sometimes really small changes, which we hope, when repeated many times by many individuals across an organisation, might have a big impact. And so finally, although this is some of our journey so far, and we're continuing to work on these pilots together, I want to leave you with 5 key messages that I hope will be useful. Firstly, that resilience is between us, it's not just within us. So supporting our team well-being is really important. that we can all help to foster a culture of care and compassion, whatever our role. This isn't just about heads of HR or psychology or OD. Every member of the organisation can play a part, and we are all change agents. And I guess I'd ask you all, what does that look like for you? That compassionate leadership and role modelling are key. It's really worth investing in supporting our supporters, including our line managers, as well as our senior leaders, I'd say. That it's okay to experiment and to vigorously discover, and to do this together. We're all learning, and so let's share some of our successes as well as indeed what hasn't been working so well. And finally, that what we've been finding is that weaving wellbeing skills and psychological safety as part of routine processes can really help to embed them. And this is about getting out of the offices and onto the wards. Thank you.
Wow, what a fantastic session. I feel like I've learned so much from all of our speakers today, and so much that I can do personally, and so much that I can work with my team to do as well. So hopefully you felt that too. I want to go back to Abdul just for a quick comment. We've got another offer that I believe that we've got running coming soon.
Thanks, Zoe. As we were talking about teaming, it reminded me of a project that we're currently working on. It builds on some reflections that we've had back from participants on our leadership circles offer. As a result of that, we are actually planning to work with Michael West and the Athena group to design guidance materials to re-establish purpose, belonging and trust in teams, to recover lost ground in terms of effective team functioning, and capture and build on learning and innovation. That will have around 7 training modules around the following 7 behaviours: reunite around shared purpose and a new direction, take time out to reflect, value different experiences and manage conflict positively, accept that the future is uncertain, promote belonging, celebrate success, and embrace remote working. So I think links nicely back to the last 2 kind of presentations that we've had, and I think it makes us kind of feel a bit more excited that we're actually talking in the same landscape. So really looking forward to those offers.
Thanks, Abdul. So we'll let everybody know about these through the usual routes and through these sessions as well. And I'd really love your help as well in letting us know what you'd like these next sessions to be. So they're the second Wednesday of every month, same time, same place, every second Wednesday of every month, 4 till 5. So what are the parts of the people plan, the people promise that you think, oh, how could I implement that? Or I'd just like a little bit more help. So is it around, there's been lots of information about managers. So is it around managers? Is it about loving your line manager, or line managers loving the work that they're doing? So let us know either in the chat box or email me. We'll put my email address in the chat box as well. But we will be hosting the next session on Wednesday, the 14th of October. Before you leave us, we'll have our usual poll that we will put we'll set it live now. So to what extent has today's session been useful in your own role in supporting health and care staff? So please do, let's make that live. And if you're in YouTube as well, if you could put your numbers in the chat box, that would be fantastic. So let us know if it was 1, not too helpful, 2, 3, 4 and 5 is very helpful. So I can see those coming in now, and we've got the majority are saying 5, very helpful. So thank you for that. So we will see you shortly. Please do let us know via Twitter or on the chat box or via email what you're getting out of these sessions, what you've taken from today's session. I've got a lot to think about because it was such a rich session. So thank you to all of our presenters, and see you shortly. And if we don't see you before, we'll see you on Wednesday, the 14th of October, 4 till 5. See you soon.